to talk about the therapeutic doses of anticoagulants in patients who have developed thrombosis. So this is the table that we will be talking about from the Green Top guideline number 37B, and this deals with the doses of anticoagulants in a pregnant lady according to her weight. So let's get started. Now, as we all know that the first weight is in these tables is always less than 50, but here we have to remember this golden number of 19 to space the various weight ranges. Why are we taking it as 19 and not 40 like the previous video where we were discussing thromboprophylaxis? Is that there the patient was at risk of thrombosis, so a wide range of 40 and a gross giving of the same amount to a wide range of patients is acceptable when we are talking about prophylaxis. But for a therapeutic patient, the range has to be narrowed down so that we can give much more dose of the anticoagulant to the patient who's already developed thrombosis. So as you can see, the first dose which used to be 20 is now 40. Okay, so the starting of this table is doubling of the first dose. Starting of the table is doubling of the first dose that we were giving for prophylaxis. So we were starting there with 20, but here the starting in itself is from the golden number, that is 40. We all know that the most commonly used enoxaparin is the 41. So that is what we will have to start the table with. For therapeutic patients, 40 is the minimum dose that we are going to start with, and that too is given as BD. If we want to make it OD, then we will have to make the dose 1.5 times here, and for Dalteparin we have to make it 2 times. Okay, so this is something that we have to remember, that for enoxa the OD dose is 1.5 times, and for delta is double D for D. So we will have to make the OD dose double that of what we were giving as BD. Okay, now we have seen this. Why I've drawn this Parker is because this pilot pen, because for all 1990s kids, they used to buy this pen for somewhere around 19 rupees. So if you remember the pilot pen, you will be able to space the ranges of weight, and then correspondingly you can get the values. So it's very, very easy to remember that a range of 19 is what is chosen here, because we need a narrower range to give the exact doses of thromboprophylaxis for patients already having thrombosis. Now we stop when the pilot becomes a Parker. Okay, now this child has reached 12th standard and the weight has become 125 rupees, more than 125. So that is where is the upper limit, where you can be giving doses at any weight, that is even 126. You have to refer the patient or discuss the patient rather with a hematologist, because these are high risk patients with obesity. We cannot take chances. So 126 it is very, very similar to the fasting blood sugar when it becomes diabetic. So it is the same value, 126, where you have to discuss the patient's management at this weight with a hematologist. Okay, so this is, now we will talk about how we'll calculate the doses. Now see, the upper number of the range has a lower number and a upper range. This upper range, if you take the first number and you add 0 to it, you get the dose, BD dose. If you take the first number of the upper range and you add 0 to it, you get the dose. See? Then remove 9, take 1 0, you add 0, again 125, so you take 12, you add 0, you get the BD dose. Okay, and here though you have the hematologist. So to get the BD dose is very easy. Take the first digit of the upper range, add a 0 and you get the BD dose, and you want to take the OD dose, just make it 1.5 times. That is the dose plus half the dose. 1.5 times of 80 is 80 plus half of 80, that is 80 plus 40. 1.5 times of 120 is 20, 120 plus half of 20, that is 120 plus 60, that is 180. So this table is very, very easy to remember. Only 3 things that we have to remember here is the weight range, 19. This is therapeutic, so we have to have a narrow range. We cannot make it 40. First dose in the table is Alibaba, or double the dose of that of prophylaxis, which is the important enoxaparin, that is 40. The upper number of the range, its first digit, and then you add a 0, will give you the dose. And when the pilot becomes a Parker, that is 120, more than 125, or I would rather say 126, then you have to discuss with a hematologist. So if we can, and yes, for the BD to make it OD, you have to make it 1.5 times. That is all that we have to remember for the dose calculation for a patient who has got thrombosis. Now we come to Dalteparin. Dalteparin is relatively easy because the weight range is similar. Only thing that you have to remember is, again, the first dose is double that of what was the first dose in prophylaxis. Then the first dose was 2500. Here the delta first dose is 5000, which is given BD, and to make it OD you have to double it. So delta is double for the OD dose, delta double. This is something very easy to remember. So for delta you double to get the OD dose. For enoxa it was 1.5 times. This is the difference between delta and enoxa, OD and BD doses. So very easy. Now 5000. Then you have, as I said, the same rule applies here also. See, there you were adding 1 0. Here you know that this is not in tens. This Dalteparin is always in thousands. So you take a 6 and you add 3 zeros. Then again you take the upper digits first number, you add zeros. Again you take 10, you add zeros. Again you take 12, you add zeros, and more than 125 is hematologist. So when it becomes a Parker, or the valuable diabetic number of 126, you refer the patient or discuss the patient with a hematologist. So these are very easy. It is all about practice, and it is all about how much of revision we do. If we take a screenshot of the table and we put it with our good notes with a little bit of trick which has been discussed in the video, I think it is going to be impossible for most of us to forget this table, and anywhere, anytime we are asked, we'll be able to tell and solve questions with the help of these tricks. Now we have tinza dosing of tinza. These are all initial doses. After this I will discuss how we will alter doses according to the INR of the patient. So initial doses, when the patient has been diagnosed with thrombosis, this is how we will start the dose. Now initial doses of tinza, it is very, very easy to remember. Again we have, like it was 75 for thromboprophylaxis, it is 175 units per kg and once daily for treatment, the therapeutic dose. So it was 75 units per kg when it was prophylaxis. It's 175 when it is therapeutic. So it is very, very easy, and we all know the creatinine clearance adjustment for enoxa dalte. It was 30. Creatinine clearance was less than 30, and for tinza it was less than 20 tt. So we know this from the previous video. 175 is the dose for tinza units per kg, and it was 75 for tinza units per kg when we used to be talking for thromboprophylaxis. So this in a nutshell is about the treatment doses of oral anticoagulants in pregnancy. In the next video, we will talk about the dose adjustment after the initial doses. Thank you.